Good evening, ladies and gentlemen. I'm Lamy here on behalf of LammCo Pharmaceutical Research, and I'm here to present our research design for schizophrenia treatment. I'd like to begin by discussing non-experimental versus experimental research design and give some insight as to which one is the right one for our situation. On one hand, we have non-experimental designs, which can describe thoughts, feelings, or behaviors, or they can center around prediction. Non-experimental designs are useful in the beginning stages of research, and they include descriptive and correlational designs. On the other hand, we have experimental designs, and they're used to explain thoughts, feelings, and behaviors, and also to make causal statements. With experimental designs, we have way more control over the environment, and it contains independent variables and dependent variables. Experimental designs also include true experimental, where the independent variable is manipulated, and quasi-experimental, where the independent variable is being measured or observed. So now I would like to get to our proposal. Our purpose here is to determine whether the loxazine is more effective than the navine. The appropriate research design is experimental for the following reasons. For this particular research, we have the need for a far more controlled environment. We also have an independent variable and a dependent variable, which, as you might recall, falls right under experimental. We'll also have the need for group assignments, such as the placebo or control group, the loxazine group, and the navine group. For our proposed methods for this research, I'd like to get 150 patients for our sample. These participants would need to be 23 through 50 years of age, newly diagnosed with schizophrenia by a qualified mental health professional, and not currently taking any medications. Participants would be found in the local schizophrenia support groups in the surrounding areas, and they would need to fill out preliminary questionnaires and be pre-screened for any other potential mental health conditions. We'd also need to know things such as the severity of their schizophrenic episodes. We'd take this information and we'd use it as a baseline to compare to later. As for our procedure, we would have the 150 patients that we previously mentioned who have not yet been treated for their schizophrenia. One group of 50 would be randomly selected to take the navine. Another group of 50 would be randomly selected to take the loxazine, and a third group would be assigned to take the placebo. All groups will take their medication over the course of several weeks, in which we will monitor them with surveys that would track the symptoms of their schizophrenic episodes each week. These episodes and their symptoms include hallucinations, delusions, disorganized speech and/or behavior. Using the quantities from the surveys and questionnaires about the patient's symptoms, we would take note of the effects or lack thereof and use statistical measures to analyze that information. With the previous data that we collected, we would use the ANOVA to compare the results of the values retrieved from the measures during the experiment. We choose ANOVA because it is better suited for comparing multiple groups. Once again, thank you for allowing me and my colleagues here at LammCo Pharmaceutical Research to present our side on what we think the research design should be for your new drug, loxazine. Thank you.